Welcome to the Therapy Trainings Podcast, where we dive deep into the world of mental health and the art of therapy. I'm thrilled to have you here with me today for an important companion episode to the course titled 3 CE Hours: What is Acceptance and Commitment?, offered by Therapy Trainings. If you're a mental health professional, counselor, or therapist, you're in the right place. Today, we're going to explore the fundamental concepts of acceptance and commitment therapy, or ACT for short. We'll unpack key elements of the course, and I'll share additional insights to help deepen your understanding of this transformative therapeutic approach. By the end of this episode, you'll have a clearer grasp of ACT, its principles, and how you can integrate them into your practice. So, let's jump right in. Acceptance and commitment therapy is a unique approach that emphasizes psychological flexibility. But what does that mean? Psychologically flexible individuals are better equipped to adapt to life's challenges and uncertainties. They are willing to experience their thoughts and feelings without judgment, allowing them to engage in meaningful actions aligned with their values. One of the core ideas of ACT is to promote acceptance rather than avoidance. Many of us have been taught to fight against negative emotions or to push them away. In the course, we learned that this avoidance can often lead to greater distress and a cycle of suffering. It's a little like trying to hold a beach ball underwater. The harder you push it down, the more persistent it becomes. ACT teaches us that by accepting our thoughts and feelings as they come, we can reduce their power over us. To illustrate this point, let's consider an example. Imagine a client who struggles with anxiety. They might spend a significant amount of time trying to avoid situations that trigger their anxiety. In doing so, they miss out on opportunities for growth and connection. Through ACT, we help clients recognize that anxiety is a natural human emotion. Instead of trying to eliminate it, they can learn to accept it, sit with it, and still choose to engage in life. Another key principle of ACT is commitment to action. This involves taking steps towards one's values, even in the presence of difficult thoughts or feelings. In our course, we discuss the importance of helping clients clarify their values and setting goals that align with those values. This can be incredibly empowering. Think of it this way. When we commit to actions that reflect our values, we create a sense of purpose in our lives. For example, if a client values family but struggles with feelings of inadequacy, ACT encourages them to take small, manageable steps toward reconnecting with their loved ones despite those feelings. Now, let's discuss the 6 core processes of ACT, which provide a framework for this therapeutic approach. The first process is acceptance. As we mentioned earlier, acceptance involves opening up to and embracing our inner experiences without judgment. This leads us to the second process, cognitive diffusion, which is a fancy term for separating ourselves from our thoughts. Instead of being entangled in negative self-talk, we learn to view thoughts as just that, thoughts. Next is being present. This encourages mindfulness and staying engaged in the current moment. It's a powerful antidote to the distractions of the past and future. The fourth process is self as context, which helps clients recognize that they are not defined by their thoughts or feelings. This perspective allows for greater self-compassion and understanding. Now, we have values, which guide our actions, and lastly, committed action, which is all about taking steps aligned with those values. You might be wondering, how do we apply these processes in therapy? One effective technique is through experiential exercises. These are activities designed to engage clients in a way that promotes acceptance, mindfulness, and values clarification. For instance, we can use metaphors, such as the beach ball analogy I mentioned earlier, to help clients visualize their struggles. Another common technique is the hexaflex, a visual representation of the 6 core processes of ACT. This can serve as a roadmap for both therapists and clients, guiding sessions and discussions. Now that we've covered the fundamentals, let's talk about some common misconceptions about ACT. One frequent misunderstanding is that acceptance means resignation. Many people think that if they accept their feelings, it means they are giving up or will never change. This couldn't be further from the truth. Acceptance is about acknowledging reality without judgment, which actually opens the door to change. Another misconception is that ACT is only about mindfulness. While mindfulness is a crucial component, ACT goes beyond just being present. It's about taking meaningful action based on one's values, even in the presence of discomfort. So, how do we address these misconceptions with our clients? Education is key. As therapists, we need to help clients understand the true nature of acceptance and its role in fostering growth. We can use psychoeducation and share research findings that highlight the effectiveness of ACT in promoting psychological well being. Before we wrap up, let's talk about how you can incorporate the principles of ACT into your practice. One way is by integrating ACT techniques into your existing therapeutic framework. Whether you practice cognitive behavioral therapy, person centered therapy, or any other approach, ACT can complement your work. Consider starting with a values clarification exercise. Help your clients identify what truly matters to them. This can be a powerful motivator for change. Encourage them to set small, achievable goals based on those values and celebrate their progress along the way. Also, foster a culture of acceptance in your sessions. Normalize the experience of difficult emotions and encourage your clients to explore their feelings without judgment. You might say something like, "It's okay to feel anxious about this. Let's explore that feeling together." As we conclude this episode, I want to leave you with some thought-provoking insights. Acceptance and commitment therapy is not just a set of techniques, it's a way of being. It invites both therapists and clients to embrace the full range of human experience. When we practice acceptance, we create space for growth, connection, and authenticity. I encourage you to explore the course on acceptance and commitment offered by Therapy Trainings, where you can gain deeper insights and practical tools to enhance your practice. Visit therapytrainings.com for more courses and resources that can help you in your professional development. Thank you for joining me today on the Therapy Trainings podcast. I hope you found this episode insightful and that it inspires you to incorporate ACT principles into your work. Until next time, keep exploring, keep learning, and remember that every step, no matter how small, is a step toward growth.